Anterior Cruciate Ligament injuries, or ACL injuries, are a frequent sporting-related injury in Australia. Prior to contemporary surgical and rehabilitation techniques, ACL rupture was often considered a career-ending injury. Without treatment, ACL tears are thought to lead to the knee giving way during activity or sport. Since the 1980s, around 90% of ACL tears in Australia are treated with surgical reconstruction, where a counterfeit ligament is made by taking a graft, typically from the hamstring or patellar tendons. Australia and the USA have the highest rates of surgical treatment in the world, and this is increasing significantly, particularly in the adolescent population. This contrasts with much lower surgical rates in, for example, Scandinavian countries of around 50%. In 2014 to 2015, the direct hospital costs of ACL reconstruction were $142 million, or around $8,500 per surgery. Despite the high rate of surgical reconstruction and common perception that surgery is best practice, best available evidence indicates that both exercise therapy and surgical reconstruction have similar outcomes. When patients are commenced on structured exercise therapy first, with the option of surgery later if needed, current data shows around 50% do not opt for surgery at all, with equivalent outcomes to if they had received early surgery. Therefore, performing ACL surgery soon after knee injury without trialling a period of exercise therapy for at least 3 months has been called into question as potentially low-value care. Social media platforms such as Facebook are used frequently by patients to network with other people with similar health issues in order to access information and social and emotional support. Prior to August 2019, the only Facebook groups on the ACL topic were highly focused on patients who were undergoing surgery. This both reflects and reinforces the narrative that surgery is the only viable option for managing an ACL tear. In 2019, inspired by Choosing Wisely's key aims, I established a Facebook group titled ACL Tear Recovery Without Surgery. This has the aim of providing a platform for those choosing an exercise therapy pathway to provide support to others and discuss their own recovery, as well as to disseminate evidence-based resources. The group now has 5,300 members and has resulted in at least 62 planned surgeries cancelled and hundreds of patients who opted for exercise therapy first despite being recommended to have early surgery. We believe that this is a way to empower consumers to choose wisely for an ACL tear.